Hi guys, my name is Jessica Walder, and today I'm going to be talking about the healthcare system in Mozambique, Africa. Let's get started. So the country that I picked is Mozambique. Mozambique is located on the southern part of Africa. It's more of the southeast part. It's bordering South Africa, and it's also the closest country to Madagascar. Mozambique is actually ranked one of the poorest countries in Africa. Because of this reason, they're trying to implement a universal health coverage so they can get enough funds to help better the healthcare system in Mozambique. Only 50% of the population are able to access acceptable healthcare. The country is working on increasing access to healthcare services. They're trying to improve the function of healthcare facilities, and they're also working to guarantee an earlier health response time to emergencies and crises. We're now going to talk about how healthcare is funded. Healthcare is primarily funded by the Centro de Saúde, or the MISAU. They spend around 167,796 US dollars on funding its healthcare system. 48.9% of the funding comes from international funding from external sources. So essentially, half of their funding is coming from external resources. The out-of-pocket spending is 6.4%. This is below the low-income country average, which is 45.6%. As you can see, Mozambique is spending substantially less than other countries on their healthcare system out of their pocket. We're now going to talk about the process of accessing healthcare. There are 27 rural hospitals in Mozambique, 652 health posts, 8 district hospitals, 5 general hospitals, and 7 provincial hospitals. Essentially, there's only one health unit per every 15,000 people. 40% of the population, they have access to the facilities that I previously mentioned, and the remainder of the country comes from more of the rural parts. So they use more traditional medicine, community health agents, and traditional birth attendants. There's only a small part of the population that it uses a private healthcare, and that's usually in the cities. Some challenges to the healthcare in Mozambique is the shortage of doctors and nurses. It comes out to be one nurse for 8,000 people. There's also not enough funding in education. People don't seek healthcare fast enough because there's a limited in transportation and the roads are not equipped. There's no ambulances in the rural areas. There's also a lack of medicines and equipment. Let's say one goes to a hospital to seek emergency medical attention. That does not guarantee that there'll be nurses and doctors available to see them, and that there will be equipment and medicines that they need. There needs to be more outside funding to be able to help better the healthcare system, and people can't afford healthcare and they can't afford the transportation. People also don't have the information that they need to be able to decipher if they need to seek medical attention or not. And there's also a problem in having a trained workforce. So some of the people working in the healthcare industry are not properly trained. These are the challenges that Mozambique faces and a reason why there needs to be more funding and more global international help. Thank you guys for listening.